Hello everybody, welcome to my clinic. If you were with me in lecture the other day, you saw my clinic a little bit already. Today we have one of my techs, Griselda, helping us out today, and Madison is on camera. So today we're going to be talking about ultrasound application. It's actually relatively simple. There are a few things that you want to consider when you are choosing an ultrasound treatment for a patient, or when the physical therapist is prescribing that for a certain patient. So the first thing we're going to look at is the body area. So we're going to start out with a smaller body part and go through the parameters that we would use for a smaller body part. And by smaller body part, I mean something that is relatively superficial. So we're going to go with the lateral epicondyle here today. Let's say the patient had some lateral epicondylitis. We wanted to heat up the tendon, and as we discussed in lecture, I'm going to pretend like we've already had lecture, but as we will discuss in lecture, the effects of ultrasound are, ultrasound is a lot more effective in heating deeper, more dense tissue. So things like tendons and then scar tissue, anything with a relatively high collagen base to it. So it's going to be slightly effective in heating up muscle tissue, but not great, and also not great at all in heating up subcutaneous or fatty tissue. So since the lateral epicondyle is relatively superficial, we're going to go with a much higher frequency, shorter wavelength when we're picking our frequency. Right there. So we're going to go with 3 megahertz, depending on your unit. 3 megahertz should penetrate about 2 centimeters into the skin, up to 2 centimeters, I should say. And a 1 megahertz, which we'll discuss in a minute, will penetrate up to 5 centimeters, depending on the impedance of the tissue that we're going through. So with this particular case, we're going to go with 3 megahertz. If we're trying to heat up the tissue, if we're going for the thermal effects of ultrasound, we're going to use a continuous setting. Most of the research has been done on a continuous setting or a 20% setting. So when we're talking about non-thermal, I'm going to typically use the 20% because that's been the most researched. Now it is, we should get some of the same effects or a hybrid effect of heat and non-thermal if we went to 50, but again, that hasn't been shown to be the case in research. It's just an extra setting that they can use as a selling point. Same thing with 2 megahertz right here. Not a lot of research done specifically on 2 megahertz ultrasound, but you can imagine if the 3 megahertz penetrates about 2 centimeters and the 1 megahertz penetrates about 5 centimeters, we're sitting at about 3.5 when you go to a 2 megahertz setting. So again, that depends on the impedance of the tissue. Muscle is going to have a little higher impedance than subcutaneous tissue or fat. So. Okay. So what we're going to do, you can do it one of 2 ways. You can either put the medium, the transmission medium, directly onto the skin or onto the ultrasound. The important thing is to apply that and apply the head to the area before you actually start the ultrasound. Because we have a piezoelectric crystal in here that's creating, or piezoelectric, however you want to say it, that's creating that ultrasound, creating those waves that go through the skin. If we don't apply a medium, or if you don't have a little bit of pressure on the head, there is a potential for that piezoelectric crystal to rattle off the transducer. It's really just a precaution that most people most places will tell you when you buy it. Again, haven't heard a lot of research done on that, but that's what we're trying to do. So first off, I like to put it here on the head, mostly because I like to make the little ice cream cone design at the top. Then we're going to place that on the area. Now this there are ultrasound heads or transducers that are a little bit smaller. One thing I should mention before we start this is that the effective radiating area of this transducer head isn't the complete head. So we're not getting sound waves through the entire transducer here. It's really the middle third of this that's getting the most, or the spike in the ultrasound activity. So that's where it's going to be the most effective. And when we are determining the area, or how big of an area we want to treat, we're going to go anywhere between, the research shows anywhere between 2 and 4 times the size of the effective radiating area. To be safe, you know, usually if the area that you're treating is two times the size, that's about where you're going to want to keep it. So you make sure you get all of the benefits possible for the ultrasound. So again, like I said, I'm going to place that on the area to be treated. I'm going to use the treatment time of 8 minutes, and that's what most of the research is done on, mostly because that's the minimum amount that Medicare would pay for. But that has been shown to be effective in the research, so we're going to do a 3 megahertz because it is a relatively superficial site. Let's say we want a little bit, we're going for a thermal effect. With a 3 megahertz, you are going to get more heating with a lower wattage than you will with a 1 megahertz. Because when we're talking about the frequency here, a higher frequency equals more vibration, that equals more heat. So, you know, when we go on to the 1 megahertz setting, to get a similar heat, we're probably going to want to go a little bit higher than 1.5 megahertz. Or sorry, 1.5 on the intensity. Watts per centimeter squared is what that is. So I've got the head, the sound head on the treatment area. I'm going to hit start. As I am making small circles here, you're going to want to overlap by about half of that ERA, half of that effective radiating area. And so you can see my treatment area is about 2 times the size, but I'm making about 3 little circles as I go back and forth here. So if we're going for a thermal effect, the patient should feel a mild heat. It won't be anything extremely hot or anything like that, but you do want to make sure the patient is communicating with you as you are running the ultrasound, because if we do get